psychiatry, pathology, malingering versus factitious disorder versus somatic symptom disorders. Okay, so for all of these disorders, you have to take into account two things: the symptoms and the motivation. Okay, so first off, malingering. A patient's going to present to you with symptoms, for example, chest pain. Okay, and then they have a motivation in mind. Okay, if I go to the hospital and say I have chest pain, I'm going to be able to get off work. Okay, they can give me, they can tell me, the doctors can tell me I can stay off work for a week. Okay, so that's malingering. So it's consciously lying or falsifying your symptoms. You don't have any symptoms. You consciously lie about that symptom for a conscious reward. Okay, an intentional motivation. So the reward would be getting a day off. Okay, so both the symptom and the motivation is intentional. I'm consciously lying and faking my type of symptom in order to get something out of it. And I know that I want that thing out of it. Okay? And so right when you get that thing, right when the doctor signs a note, hey, you're fine, you could be off work for 2 days, the patient's like, okay, their symptoms resolve after they get that paperwork. And they're like, oh, I no longer have chest pain. Okay? So that's key to malingering. And then also another key portion to malingering is that the patient will usually deny invasive procedures. So if a patient comes in with like neck stiffness and headache, they're like, oh, my neck's super painful. And so you have to rule out meningitis, for example. And you're like, okay, let's take them to an LP. Let's get them a lumbar puncture. Then usually the patient's gonna be like, well, actually, I'm not too sure. So they're gonna deny, they're gonna avoid invasive procedures, right? So that's malingering. Both the symptoms and the motivations are intentional, okay? Now for factitious disorder is known as Munchausen syndrome, okay? And Munchausen syndrome can be both imposed on self, so factitious disorder imposed on self, or factitious disorder imposed on another, which is Munchausen syndrome by proxy, which I'm sure you guys all know. This is the story of Gypsy Rose. Her mother had Munchausen syndrome by proxy, so she imposed this on her daughter, okay? Now, what is factitious disorder or Munchausen's? So the symptoms are intentional, but the motivation is unconscious. So what does that mean when the motivation is unconscious? So the patient's going to be forcing someone else to fake a symptom. So the patient's going to fake a symptom. They know they're faking the symptom. Doc, I have chest pain. Okay. But the motivation is unclear. They're not trying to get off work. Okay. They don't notice that they're trying to do anything. So they have an unconscious motivation of something. All right. So they don't realize that there is some type of motivation behind it, whether that motivation might be, fame or money or, feeling like, sympathy from other people, right? So they will receive that, okay? And that can be a form of motivation, but they don't realize, okay? They don't realize that they're doing it for that specific fact, okay? So that's key to factitious disorder or Munchausen's, okay? Very, very important. Now, factitious disorder or Munchausen's that's imposed on self is very common in healthcare workers. Okay, so what you're going to be seeing is in any patient, not only in healthcare workers, but this is besides the healthcare worker fact, but healthcare workers are at an increased risk for factitious disorder. Okay, but what you have to realize also separately is that if you see a history of multiple hospitalization admissions, and they will be willing to do invasive procedures. They have a willingness to do invasive procedures. If you remember Gypsy Rose, she had a G-tube placed. Her mom forced her to have a G-tube placed. Crazy procedures, okay? Crazy procedures that are done. All right. Now, remember, healthcare workers at increased risk for factitious disorders imposed on self. Lastly, somatic symptoms. All right. So somatic symptom disorders. Now, these are very important because the symptoms are actually real. This is the first and only one where your symptoms are actually real. Okay. So they have real ongoing symptoms that are not faked. Okay. And the motivation is just like not there. It's unconscious. Just like factitious disorder, they don't really know that there's any motivation, okay? They don't realize that there's any motivation, okay? So remember, they feel somatic symptoms, okay? And that's very key. So symptoms are not intentionally produced or created, all right? So now, first one, somatic symptom disorder, okay? Somatic symptom disorder is greater than one bodily complaint. So it could be like, abdominal pain or chest pain or fatigue. And it lasts months to years. Okay, that's not important. But what you have to know, it's associated with excessive, persistent thoughts and anxiety about the symptom. Okay? Very important to know that. It's excessive and persistent thoughts about that certain system. So they will have like abdominal pain. So remember, that pain is real. Okay, so they will have abdominal pain, but then that abdominal pain, they will have excessive and persistent thoughts and anxiety about that abdominal pain. That's somatic symptom disorder. Okay, and what the treatment is that something that you have to remember. They're going to try to hide it, but remember that you have to have regular office visits with the same physician. The patient needs regular visits with the same doctor, because if you keep on jumping around to different doctors, the doctors aren't going to know how to treat this patient. And in reality, you need the same doctor to understand that the patient's undergoing this somatic symptom disorder. Okay. Another one is conversion disorder. Conversion disorder is like some type of functional neurological symptom disorder. Okay. So these patients will have like a loss of sensation or motor function, and like they can come in with like blindness. I remember I saw this actually on one of my rotations. This patient, she came in and she was blind. Okay. She was unable to see out of her right eye. And it was just a random, it followed an acute stressor, which is usually seen in conversion disorder. But there's no pathological thing that is defining the blindness. We don't know what is causing, there's no pathology that's leading to the cause of the blindness. It's just present. So that's the weird thing, okay? So the patient, she was unaware, like she was aware of this, she was aware of the blindness, but she didn't really care too much, which was also weird in that scene. Okay, so they're aware, but they're indifferent towards the symptom. Okay, now once again, most common in female adolescents or young adults. Okay, so you're going to see this is a neurological disorder following an acute stressor, and the patient is indifferent towards the symptom. That's conversion disorder. Okay, so if you see some type of neurological deficit, inability to move, inability to see, inability to feel something, and there's like they've done all the tests, there's nothing that they they can't figure it out, it's probably going to be conversion disorder. And then last one's illness anxiety disorder. Illness anxiety disorder is going to be preoccupation with acquiring a serious illness or having serious illness. And I'm sure you can I feel like I know a lot of people that have potentially, a mild effect of this, where someone is just so afraid of getting sick. Okay. They're just like, I'm preoccupied. Do I have cancer? I'm constantly thinking, do I have cancer? Do I have cancer? Do I have cancer? But the key thing here is that they have no somatic symptoms. Okay. So they have a preoccupation with acquiring or having a serious illness. So they're worried about having cancer, but they have no symptoms of cancer. So for example, like if you have a patient, they say, I'm really scared about I have brain cancer. Oh, okay. Well, have you had any headaches? No. Okay. Have you had any, syncope? Have you had any loss of vision? Have you had any symptoms associated with some type of tumor of the brain, paralysis in the legs, anything like that? No. So then that's when you know that it's more of an illness anxiety disorder. Okay. So one last time as an overview, malingering is intentional symptoms, intentional motivation. Okay. I'm faking my chest pain so that I can get 2 days off of work. And I know I want those 2 days off. Okay. Factitious disorder, I'm faking a symptom. I'm faking my chest pain. But there's no real motivation behind me doing it. That's what they think. But in reality, there is, right? They want some type of money. They want some type of sympathy from other people, okay? But they don't notice it. It's unconscious. And then for the somatic symptoms, it's going to be both unconscious. The symptoms could be present and could be real to those patients, and then their motivation is just unknown, okay? They don't really think that there's any motivation towards them, okay? So remember, those 3 key things and you'll be fine, okay? So that's malingering versus factitious disorder versus your somatic symptom disorders.